Hey innovators! Julia here, your digital career coach and AI learning companion. Let me start with something bold. AI is no longer just for work, it's transforming how we live and heal. In this session, we're diving into how AI becomes your thought partner in healthcare. Helping you understand medical terms, build better communication with your doctor, and take control of your wellness journey. Because when technology and empathy work together, healing becomes human again. Every day, we welcome AI into our lives, often without realizing it. It helps us write emails, find recipes, manage our schedules, even craft resumes that open new doors. AI has quietly become our thought partner, always available, always learning with us. But now, something even more powerful is unfolding. AI is stepping into one of the most personal, meaningful parts of our lives, our healthcare journey. Imagine AI not just answering questions, but helping you understand your diagnosis, interpret your lab results, or prepare questions for your doctor. It's not replacing the human experience, it's amplifying it. With today's advanced AI models, like ChatGPT and Gemini, we can now turn complex medical language into clarity. AI reads, explains, and translates in real time, giving you knowledge and peace of mind. Because healthcare can be confusing. Studies from Gallup reveal that nearly half of all patients leave their doctor's office unsure of what was said. Time is short, emotions run high, information gets lost. When AI becomes a bridge between patients and practitioners, communication improves, and better understanding leads to better outcomes. And here's what's most exciting. AI isn't just for major procedures or complex illnesses. It can start small. Something as simple as using your camera feature in ChatGPT or Gemini at the pharmacy. Scanning a cold medicine box and asking, what does each ingredient do? You can even ask, how do I pronounce this word? You're not replacing your pharmacist. You're preparing yourself to have a more informed conversation. That's the first step in transforming from patient to partner. AI helps you build confidence, reduce anxiety, and participate in your own care journey. As one physician once said, the best medicine begins with understanding. And in today's world, AI helps us get there faster, because it doesn't just give you data, it gives you clarity. Once you've started using AI for simple tasks, you can bring that same curiosity into your next appointment. Say to your doctor, I've been using an AI assistant to help me understand my condition. Would it be okay if I used it to take notes while we talk? That's collaboration, built on respect and openness. That's where the care framework begins. Created by Yusuf Wilson in collaboration with many healthcare professionals, the CARE framework is a design philosophy for building understanding between people and technology. It stands for C. Collaboration and courtesy, A. AI insights, R. Relationship, E. Empathy. Let's walk through it. Let's start with the first pillar, C. Collaboration and courtesy. Collaboration begins with permission and trust. A patient might say, Doctor, I've been using an AI assistant to help me understand my MRI report. Would it be all right if I used it to keep notes? That small question changes everything. A. AI insights. Once collaboration begins, the AI becomes a silent bridge for insight. It can simplify medical reports, highlight terminology, and summarize your treatment options. You might prompt it with, compare recovery times for spinal fusion versus microdiscectomy for someone my age. It gives you balanced information, not a prescription, but a path to understanding. R. Relationship. Medicine is still a human story. When you come prepared, curious, and respectful, you deepen the relationship with your doctor. You might say, Doctor, here's what I found through AI. Could we review it together? That's partnership. It tells your clinician, I value your expertise, and I'm learning alongside you. E. Empathy. AI can't feel emotions, but it can help us express them. It can help you practice gratitude, rehearse difficult conversations, or translate kindness across languages. As Yusuf Wilson writes, technology should never replace the human heartbeat in care, only amplify its rhythm. That rhythm is what drives the next story, one that shows the care bridge in motion. Meet the Matthews family. An ordinary family using AI in extraordinary ways. Megan Matthews is a teacher, a mother, and someone who's been struggling with chronic back pain for months. Nothing has helped, until one sleepless night. She picks up her phone and says softly, "Julie, find a neurologist near me." That's the beginning of her journey. Megan names her AI Julie, after her daughter's favourite doll. Her little girl watches her mum speak gently to her phone, the same way she talks to her toy. It's a small moment, but it changes everything. For the first time, technology feels personal, safe, even nurturing. Before her appointment, Megan says, "Julie, list questions for my neurologist about back pain and treatment." AI helps her prepare a list, concise, informed, and confident. At her appointment, she says, "Doctor, I've been using an AI assistant to understand my symptoms. Would it be okay if I used it to take notes?" The doctor agrees, curious but open-minded. During the consultation, the doctor points to an MRI image. "Here's the herniation at L5S1. Through her earbud, I whisper, "That means one of your spinal discs is pressing near a nerve root." For the first time, Megan truly understands. Fear dissolves into clarity. Surgery day arrives. Megan is nervous. Her nurse, Jorge, smiles kindly. "You're a hard stick," he says, meaning it'll be tricky to find her vein. She opens Julie quietly and says, "Julie, explain what's happening while they place the IV." Julie replies gently, "They're finding the best vein. Take a deep breath. You're safe." Her pulse steadies. A patient nearby speaks only Spanish and looks anxious, and shares with Megan, "La enfermera está preparando su vía intravenosa. Todo está bien." Megan is concerned and quietly asks Julie to translate that for her. Julie shares, "The nurse will work to insert your IV." Megan feels relieved as Jorge gently continues to insert her IV. The woman smiles and nods at Megan. That's the care bridge. Extending across language, fear, and empathy. While Megan is in surgery, her elderly parents use their voice mode ChatGPT to navigate the hospital halls and interpret the surgical progress board. Phase 3, closing, means the surgeon is finishing the operation. A small translation, but one that brings big relief to the nervous and anxious loving parents. Loving hours later, Megan wakes up in recovery. Her husband opens me to read the discharge papers aloud. Take 1 tablet at 8 a.m. and 1 at 8 p.m. Avoid heavy lifting and follow up in 2 weeks. The words, once overwhelming, now feel manageable. "I feel like I have a team helping me," Megan says softly. At home, her daughter places her doll next to the phone and says, "Now both Julies can help you." Together, we build a recovery plan. Medication schedule. Gentle stretches. Gratitude journaling. Megan writes, "Dear Julie, today I walked to the end of the driveway without pain. I smiled. I remembered I'm not alone. That's the heart of this story. AI didn't heal her body. It helped heal her understanding. It gave her back confidence, calm, and connection. Because healthcare isn't just about medicine. It's about meaning. And when AI helps us understand, we begin to heal from the inside out." So what can we learn from the Matthews family? That technology doesn't make us less human. It reminds us how human we already are. AI is at its best when it partners with empathy. amplifying what we do best: listen, learn, and love. If this story inspired you, subscribe to this channel and join me at the Quantum AI Learning and Coaching Academy. Together, we'll explore how AI can help you future-proof your career, your health, and your life. And be sure to pick up Yusuf Wilson's new book, AI and Human Collaboration Blueprint in the Age of the Agentic World. Because the future isn't coming. It's here. And when we collaborate with it, we don't just change technology, we change what's possible.